Welcome to the webinar Tag in Action, Helping to Build Healthy School Communities Through Wellness Centers. The Successful Strategies for Improving Adolescent Health webinar series sponsored by the HHS Office of Adolescent Health. This webinar is one of a series highlighting local, state, and national efforts to improve adolescent health, and it is part of a national call to action called Adolescent Health, Think, Act, Grow, or TAG. My name is Evelyn Kapler. As Director of the Office of Adolescent Health, I'm very pleased to be with you to talk about TAG and to share information about a successful strategy to improve adolescent health. This webinar highlights work by a group called Identity Incorporated in Gaithersburg, Maryland, which is providing health care in schools in order to improve both health and education outcomes. Today we're joined by Carolyn Camacho, the Youth Centers Director at Identity, Inc. Before I turn it over to Carolyn, I'd like to share a little bit about the Office of Adolescent Health. The Office of Adolescent Health is located in the U.S. Department of Health Services. The office was first funded in 2010 and charged by Congress with developing a national plan for improving adolescent health. We've used our limited resources and the input of experts to size what we know about what works, spur action in support of adolescent health. The TAG call to action is a first response to that charge. With this webinar, we're pleased to share an example of a program making it easier for young people to gain access to health care. TAG identifies access to health care as one of 5 essentials for healthy adolescents. TAG builds on the collective work and of many professionals, researchers, and family members who know what it takes to promote the health and healthy development of America's 32 million adolescents. Teens are generally healthy, yet there are many missed opportunities to promote health and to intervene promptly in challenging health issues that emerge in adolescence and young adulthood. TAG, comprehensive, strengths-based, positive youth approach to health rather than a risk-based approach. TAG is designed to help young people reach their full potential as healthy, productive adults. With TAG, we hope to spread action across multiple groups of professionals and organizations and in communities that all share a common interest in promoting adolescent health. Stakeholder engagement is a core tenet that drives all aspects of TAG and reflects our understanding that many determinants of adolescent health lie outside the healthcare system. The goals for TAG are the following: to raise awareness about the importance of adolescent health, to engage stakeholders, including youth-serving organizations and caring adults, to get adolescent health on the national agenda, and to spur action. Long-term, TAG contributes to achieving the Healthy People 20 Objectives for Adolescent Health developed by HHS. More details about TAG and the 5 essentials for healthy adolescents can be found on the Office of Adolescent Health website. Also, before we begin, I'd like to point out that the content and views in this next portion of the webcast do not necessarily represent the official policies of the Office of Adolescent Health or of HHS. I'm now pleased to turn things over to learn about the Wellness Centers supported by Identity, Inc. The project aims to improve access to health care for teens by establishing health centers in schools, build a community-based comprehensive approach that integrates health services and positive youth development programs with schooling. Carolyn?
Thank you very much, Evelyn. Good morning. Since 2008, Montgomery County Health and Human Services has funded our school-based health centers to improve the health and healthy development of adolescents in partnership with community-based positive youth providers like my organization, Identity. In Montgomery County, over the past decade, our schools have faced the challenges of educating a diverse and rapidly growing population of youth who have limited access to critical programs and services. These youth have enormous potential, but face many challenges that hinder their ability to succeed, such as poverty, family separation, discrimination, immigration status, cultural isolation, trauma, and other factors that may lead to risky behaviors such as teen pregnancy, substance abuse, gang involvement, and dropping out of school. Identity is the lead agency, and we manage 3 school-based health and wellness centers that were developed to respond to these challenges. We provide wraparound services of behavioral health, positive youth development, case management, and our goal is to create opportunities to ensure that our young people are equipped with the necessary skills to build effective connections within their communities and to improve their education and employment outcomes. For, after all, we know that success in school is the strongest positive indicator of future health, employment, and healthy relationships as adults. So our goal is to create opportunities to ensure that young people are equipped with the necessary skills to contribute to their community. We provide services and interventions that build emotional health by addressing the risk factors and supporting protective factors. We see our young people as assets to be nourished, not problems to be fixed. Through our programs and support systems and referrals to behavioral health services when necessary, our young people enhance their connections with their school and family and develop a stronger sense of themselves and their community and take responsibility for themselves and for their actions. In the Wellness Center, the somatic health and social service providers work together in the same space in the school to serve the students. And another key component of our work is our work with the parents. Montgomery County Health and Human Services funds 13 school-based health and wellness centers in Montgomery County Public Schools, and 4 of these centers are located in high schools. Back in 2014, as we began to work in 2 of our centers, we saw the potential benefits of working more closely with school health services and how we could have an impact beyond these 13 school-based health centers. One of the nurse administrators attended a parent session we had organized, and she heard a parent ask a question about where families could obtain low-cost or no-cost dental health services. So, of course, she answered the question and provided the information, but then she went back and she made sure that not just the 13 school-based health centers had that information in the clinic, but that every health room in Montgomery County Public Schools had information on low-cost dental health services in the community. So that's just one example of how we can extend the impact of our work beyond the doors of the school-based health centers. On the youth services side, Identity works in partnership with other agencies that are our partners, and we provide positive adult role models, curriculum-based programs, trauma-informed restorative practices, wraparound support services, arts and recreation activities, and mental health services. Identity and its partners forge trusting relationships with our young people through theoretically sound but culturally relevant programs that are based on the positive youth development model. Much of the success of our programs is due in part to our staff, who are bilingual, culturally competent, and many have similar backgrounds as the youth in terms of race, ethnicity, language, country of origin, and sexual orientation. We're proud to count former clients who have been there, done that, and have come back to be members of our staff. This slide shows the demographics of the 3 high schools where we manage the wellness centers. And as you can see, the site selection for the school-based health centers are based on several different factors: the high need, high farms population, diverse student population, substantial number of students who are receiving English as a second language. And last year in 2017, in the fiscal year, we served over 1,300 young people and their families at the 3 school-based health and wellness centers that Identity manages. The next few slides just give you a picture of some of the outputs. the demographics of the young people that we serve. And the next slide gives you an idea of the risk profile. So while the wellness centers are open to all the students in the school, we especially target young people who most need our programs and services. These include youth facing challenges such as adverse childhood experiences, trauma, family separation and reunification, and youth who are struggling academically or emotionally. And the socio-demographic data that you see here provides a general picture of the risk profile of the young people that we served in the last fiscal year. Adolescence is a challenging time for youth who have every benefit and advantage. But for young people who've grown up in poverty and impacted by other traumatic events, the positive adult role models, the relationships that they're able to form with their peers as well, and the programs and services that we can provide at the wellness centers can be transformational. And we've compared the rate of exposure of our participants to adverse childhood experiences with children in Maryland and nationwide, and our data shows that when we compare our data with the National Survey of Children's Health data from 2011 and 2012, we saw that our youth are exposed to ACEs and to multiple ACEs at a higher rate when they're compared to children in Maryland and nationwide. At the wellness centers, we consider the parents and families an essential part of the services that we provide to young people. We conduct a family needs assessment with the parents or guardians of the young people in our curriculum-based programs. Through these assessments, we're able to provide case management support through linkages to social and emergency services available in the community. Our parent engagement programs build the capacity of parents to navigate the school system, provide information on resources and services in the community, and focus on such topics as parent-child communication and healthy adolescent development. In addition, we strive to create the conditions for parents to build a network of mutual support in the school among other parents and in the community. For we know that parents and families are a key protective factor and ensure the sustainability of our efforts. Identity has developed rigorous data collection and evaluation methods to measure the effectiveness and impact of our wellness center programs and services. We've developed several metrics to collect baseline and exit data for each program, and they're compiled and analyzed by an external evaluator. In this slide, you can see that youth who had reported low levels of emotional well-being at baseline showed improvement at exit. So you can see here among self-esteem, we showed improvements in self-esteem, expectations for their future, anger management, and conflict resolution skills, as well as improvements in depressive symptoms. People and their relationships with each other form the cornerstone for creating a safe and healthy learning environment. And again, staying in school and graduating are the clearest indicators for future success in life. So in this slide, we see that young people who at the baseline had low levels of school connection after participating in the programs and services in the Wellness Center at exit showed improvement in the different measures for school connectedness. A key tenet of our organization and the positive youth development model is to meet young people where they are. Our programs seek to build on youth strengths and help them recognize the consequences of risky behaviors and make healthy, positive choices. Here we see that youth who at the baseline had high levels of risk factors at the exit showed improvement or a decrease in gang and delinquent-related behaviors, substance abuse, and unsafe sexual behavior. Oh, I apologize for that. Okay, over there. Researchers over the years have learned a great deal about the factors that contribute to healthy adolescent development. These include family dynamics, support from caring adults, school effectiveness, peer influence, value development, and social skills. When we work together to provide comprehensive services on site with our somatic health partners, it can be transformational. We believe that community-based positive youth development providers, when we work closely with our somatic and mental health providers, we can really make a difference in the lives of our young people. And I wonder if you have any questions.
Thanks, Carolyn, for your work and for your presentation. Yes, I do have a few questions for you. Can you tell us a little bit about how you got buy-in you needed to work in the schools?
Evelyn, I think from the get-go, the schools, as I've mentioned, the school-based health centers were an initiative funded by Montgomery County Health and Human Services in response to the need that they saw and the schools were seeing about a decade ago. So they developed criteria. I believe about 22 indicators that they looked at for the different schools to see, to rank schools in who needed this kind of school-based health center. So what we found in all the schools that we work at, that we're greeted with open arms, and principals and staff really see the benefits of having comprehensive health and positive youth development services in the schools.
Well, that's terrific. And can you tell us a little bit about how you handle funding and reimbursement for the services that are provided?
Identity is the managing agency at the wellness centers that we manage, so we respond. It's a competitive process. We develop a proposal in response to a request for proposals, and we compete with other community organizations to manage the wellness centers.
And you talked a little bit about the work that you do with parents. Can you tell us a little bit more about any of the lessons you've learned in working with parents and families?
Yes, I think that building relationships are the key to being able to impact the lives of young people and their parents. What we found is that many of the families of the young people that we serve are face many barriers in their daily lives, but they do have a level of comfort in going to the schools. So just like we're serving all the needs of the child, the health, the social, emotional well-being of the young person, the fact that parents can get connected to the social services in the community, can get connected to the school, can build relationships with the teachers, the counselors, the administrators by attending the meetings that we organize in collaboration with our school partners. There's also opportunities for parent leadership and student leadership through our Wellness Center advisory boards. And again, I think that just as we've seen that the importance of connecting young people and having them feel a part of the school, I think the same goes with the parents, that the more that we can encourage that and build those connections, the better off our young people are, and we've seen that they're more likely to stay in school and graduate, and that's our common goal.
And the work you do really focuses on positive youth development and is a collaborative effort with partners. Can you tell us a little bit more about the work you do with partners?
Yes, it's critical. It's essential. The beauty of the model, and I think it's also the way things are done in our county. So we have the health services that are provided by the health department in the wellness center, and then through the partnership in our wellness center model, where we have other community organizations with expertise in mental health and in serving African American population, and we also have partnered with arts organizations. Everybody brings their strength to the work, and together we're able to accomplish a lot more than we could individually. And in addition, we rely on the a strong network outside of social service providers, again, that we connect with, that we bring in to enhance our services at the school, but also to connect the families with some of the resources that are out there as well.
Terrific. And before we wrap up, I have one final for you. What are your goals and plans for the wellness moving forward?
We are always striving to continuously improve our programs and services, especially to continue to respond to the trends that we see and the needs of our young people in the schools. I would say that one of our key efforts now is just continuing to strengthen our collaboration with somatic health. For example, we, as I mentioned before, in providing trauma-informed care, both our somatic health partners are working to screen young people who have been impacted by adverse childhood experiences, and on the positive youth development side, we work very closely with them so that we're also working to build relationships with these young people and help them heal from the traumatic events in their lives, but also to develop strategies and tools for themselves so that they can grow and thrive. And we're also always working to strengthen our tools so that we can evaluate the impact of our programs and services. And it's just a great honor to be able to have to work with all these wonderful providers and to be able to be involved in the lives of our young people throughout their high school years.
Well, thank you, Carolyn, and thank you for sharing such rich information with us about the wellness centers. On behalf of the Office of Adolescent Health, I want to thank you for joining us to learn about OAH and TAG and to hear about the wonderful work going on in Maryland. A special thanks to Carolyn for sharing this program with us. The TAG effort is, and we invite you to get involved and spread the word about TAG in your professional networks. And there are several ways in which you can do this. You can explore our website. You can check out the TAG book. You can join TAG and get email updates. You can watch one of the TAG Talk videos with your colleagues. You can notify your colleagues and grantees about TAG. And you can encourage your organization to use TAG action steps and resources. You can also blog about TAG. We have sample text on our TAG toolkit. You can ask questions, share ideas, and get in touch. I urge you to use TAG social media tools to reach out to some of America's 2 million teens and folks who care about them. And you can do this at hashtag TAG42mil. And here again are some specific ways you can connect with the Office of Adolescent Health and TAG. You can explore our website, download materials, sign up for e-updates. You can watch us on YouTube, send your ideas and questions to tagteam@hhs.gov, and you can follow the Office of Adolescent Health on Twitter at TeenHealthGov and use hashtag TAG42mil. Thank you for the opportunity to share TAG and a great example of TAG in action with you today.